Indian American doctor accused of trading painkillers for sex and committing healthcare fraud. Case overview. Ritesh Kalra, a 51-year-old Indian American internal medicine doctor from Secaucus, New Jersey, faces serious allegations of abusing his medical position to distribute addictive painkillers, opioids, without legitimate medical purpose, coercing patients into sexual acts in exchange for prescriptions, and defrauding New Jersey's Medicaid program. The case, announced by the U.S. Attorney's Office for the District of New Jersey on July 18, 2025, has shocked the medical community and the public, highlighting issues of power abuse in healthcare and the ongoing opioid crisis in the United States. Key allegations. According to court documents from the U.S. Attorney's Office, Dr. Ritesh Kalra is accused of operating a pill mill at his medical office in Fair Lawn, New Jersey. He faces 5 counts including 1. 3 counts of distributing opioids outside the scope of professional practice ***. Kalra allegedly prescribed over 31,000 prescriptions for oxycodone and promethazine with codeine between January 2019 and February 2025, often without a legitimate medical basis. On some days, he issued up to 50 oxycodone prescriptions in a single day. 2 counts of healthcare fraud. Kalra is accused of billing for office visits and consultations that never occurred, defrauding New Jersey's Medicaid program. His electronic medical records reportedly contained falsified progress notes, with repetitive content across patients and no documentation of required vital signs. Coercion and sexual misconduct. One of the most egregious accusations against Kalra is that he exploited vulnerable patients, particularly those struggling with opioid addiction, by coercing them into sexual acts in exchange for prescriptions. Former employees at Kalra's practice reported that multiple female patients complained of inappropriate touching and demands for sexual favors, including oral sex, to obtain prescriptions. One female patient alleged that Kalra sexually assaulted her multiple times, including forcing anal intercourse during medical visits at his office. Another case revealed that Kalra continued prescribing opioids to a patient even while she was incarcerated at the Essex County Correctional Facility, without any medical interaction. These actions were described as exploiting patients' trust at their most vulnerable by FBI Special Agent Stephanie Roddy. Medicaid fraud. In addition to allegations of sexual coercion and illegal drug distribution, Kalra is accused of defrauding New Jersey's Medicaid program by submitting claims for fictitious office visits and consultations. His medical records allegedly included fabricated progress notes with repetitive, boilerplate content and lacked essential medical data, such as vital signs. These actions not only violated the law but also undermined trust in the public healthcare system. Legal consequences and current status. Kalra made his initial court appearance on July 17, 2025. Before U.S. Magistrate Judge Andre M. Espinoza at the Newark Federal Courthouse. He was released on a $100,000 unsecured bond but is under home confinement and barred from practicing medicine or prescribing drugs pending trial. His Fair Lawn practice has been ordered to close during this period. If convicted, Kalra faces up to 20 years in prison and a fine of up to $1 million for each count of distributing controlled substances. Up to 10 years in prison and a fine of up to $250,000, or twice the amount of ill-gotten gains, for each count of healthcare fraud. Responses from defense and authorities. Kalra's attorney, Michael Baldassari, has vehemently denied the allegations, calling the government's press release something akin to a supermarket tabloid. He described Kalra as a respected physician and dismissed the accusations of misconduct. U.S. Attorney Alina Habba emphasized that Kalra's actions not only broke the law but also endangered patients' lives and exacerbated the opioid crisis. She stated, "Physicians hold a position of immense responsibility, but, as alleged, Dr. Kalra used that position to fuel addiction, exploit vulnerable patients for sexual gratification, and defraud New Jersey's public healthcare program." The U.S. Attorney's Office vowed to continue prosecuting those who misuse medical licenses for personal gain. The Federal Bureau of Investigation, FBI, Drug Enforcement Administration, D, and the Department of Health and Human Services Office of Inspector General, HHSOIG, are jointly investigating the case. The FBI has urged former patients or anyone with relevant information to contact them via the toll-free hotline at 1-800-CAL-FBI, background and significance. Ritesh Kalra, a graduate of the Medical University of Silesia in Zabrze, Poland, has practiced medicine in the U.S. for over 20 years, specializing in primary care and internal medicine. Previously, in 2016, the New Jersey Supreme Court ruled against him for failing to pay $12,000 in wages to a former employee, Amal Musallam, for 3 months in 2013. Kalra's case unfolds amid the U.S.'s ongoing efforts to combat the opioid crisis, which claims tens of thousands of lives annually. His alleged actions are seen as a grave betrayal of medical ethics and patient trust. Naomi Gruchich of HHSOIG stated, "Physicians who recklessly distribute controlled substances illegally undermine critical efforts to combat the opioid crisis and betray their professional responsibility to the health and welfare of their communities." Conclusion. The case of Dr. Ritesh Kalra serves as a stark warning about the consequences of abusing authority in the medical field. The allegations against him have not only tarnished his reputation, but also shaken confidence in the healthcare system. Kalra is presumed innocent until proven guilty in a court of law. The investigation remains ongoing, and authorities are calling on potential victims or witnesses to come forward with additional information to aid the case.